My name is J. Randall Wilkerson. I am the author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is the first introductory video of a series of 58 videos that will go into each chapter and subchapter for the purpose of teaching you how to recover from heart failure, a natural treatment plan to restore your heart to normal, and also the material that you will need for prevention and ultimately cure from heart failure. In 2005, I was admitted with class 4 heart failure into the hospital emergency room. At the time, it had been caused by a defective heart nerve, and I had reached a level that was typically fatal in a matter of weeks. 10 months later, I was bicycling 32 miles in a single morning, and by 2009, my doctors at the cardiology office had declared that I was completely cured, and in all of their studies, the only class 4 case to be totally cured in the United States. I do not believe that. I have run into a few others who have discovered the enzymes necessary for recovery, as well as cardiac rehab. And in some parts of South America, the Caribbean islands, and parts of Asia, the doctors have a typical prescription that does work and is successful. This book is available on Amazon in both print and Kindle digital editions. It's available at Apple iTunes Store for an iBooks EPUB 3, which can also run on Samsung and Android devices. It's available on eBay in print edition, and it's also available from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24 to cover shipping as well as the book, and we will mail it right out. Now, with every self-help book, there's a disclaimer right in the beginning, and I will read that. The information and advice contained in this book on heart failure recovery is founded on scientific clinical research and my personal experience. This book is not intended as a substitute for consultation with a licensed cardiology doctor. Any statements made in this book have not been evaluated by the FDA and are not intended to diagnose, treat, or cure any disease. The publisher and author are not responsible for any consequences resulting from the use of these recommendations or procedures listed in this book. A medical professional licensed as a medical doctor in your locality should supervise all matters pertaining to your personal physical condition and health. Discuss with your doctor all information contained within this book. Do not withhold any information from your doctor because you feel he will not approve or judge you. He needs to know your thoughts and actions. Now, as a background, this book is not about bashing doctors or going a naturopathic method based upon case studies of individual persons. You will need the very best cardiologist in your community once you have been diagnosed with heart failure or heart disease. If he does not agree to work with you, then seek out another second opinion from someone who is willing to review the clinical trials, the scientific studies upon which everything in this book is based. The basis is recorded in footnotes. There are 150 footnotes with 215 citations of the scientific, mostly university-based clinical trials. These were conducted over recent years and have been found to be successful in treating many, many thousands of heart failure patients. And so therefore it is not basically an opinion-based fringe document. When I was released from the hospital, I could not walk 80 feet. I had class 4 heart failure, and the mortality rate is typically 78% in the first 12 months. All die within 24 months. any diagnosis of heart failure is a terminal disease. Your doctor may not have told you this if you have heart failure because there is no pharmaceutical treatment, and 1 in 5 Americans, or 20%, will contract heart failure and die. Unlike cancer, which has often a treatment plan, the medications dispensed for heart failure patients simply lengthen the condition and slow it down, but they do not stop it, and they are not a cure. So doctors often assume, well, if there is no cure, why bother troubling the patient? With the knowledge that it is a terminal disease. 680,000 new cases in the United States occur every year, and the death rate is over 1,000 per day. If you apply this program, the clinical trials indicate a survival rate of at least 4 out of every 5, and possibly could approach 8 out of every 9. It will be yet to be seen if everyone who applies all of the supplements and lifestyle changes in this book will benefit. The 4 out of 5 documented cases comes out of just testing one supplement in the book. So let's get it down to brass tacks. This book can restore your condition to normal, to an indefinite lifespan, if you apply what's inside. The Heart Failure Recovery Plan is hardly radical, very conservative in fact, because anything that did not improve outcomes more than 10% in clinical studies has not been included. I decided that the only way to have a sound treatment plan is to only include those clinical trials which had successfully improved outcomes in large percentages, that is beyond the placebo effect. So this is the end of the introduction. Follow along from our channel. They will be labeled Part 1, Part 2, Part 3, and so on. And we will lay out everything in the book and therefore provide you with a preview of what is contained inside. This information, much of the information inside, has not been revealed in any other book. It represents 9 years of testing and research, and 4 years of the past 4 years assembling all of the clinical material. Thank you. My name is J. Randall Wilkerson, and this is the Heart Failure Recovery Plan.